Good afternoon, everyone. We will get started in a minute or two. I just want to give enough time for folks to finish joining, so we'll probably start at two after. Thanks for joining. Thanks all who just joined. We will get started in about 2 minutes. Give folks like 30 more seconds. All right, let's go ahead and get started. Thanks for joining the session today. This is the CRISP overview or new user training, as we call it. It's designed to help new and returning users to learn about CRISP's mission, value, and tools. My name is Kevin Phillip, and I'll lead our presentation today. I work as part of a broader user engagement team headed up by Jessica, and then my colleague Laura also helps with a lot of the work that we do to build training materials and content related to helping folks understand and best utilize CRISP. Here is our agenda for this training today. We will talk about what CRISP is. We will talk a little bit about what we offer, a little bit about account setup and management, and then we'll do actually a demo of some of our core products and overview. This session is not fully intended to go through every single product in minute detail. But rather give you a broad sense of how you could use CRISP and some of the core tools. And it's not an exhaustive list of everything that we do. We have lots of other ancillary tools and data integrations and things of that nature that I'm happy to get into with the questions. But for the purposes of this training, my hope is that you walk away with a good understanding of what CRISP is, what we offer, and then our core products at a very high level. Before I jump in to the training, I did want to cover a few housekeeping items. The first is this session's going to last about an hour. We probably will have 10 or 15 minutes at the end for dedicated Q&A. So if you have any questions, please feel free to write them in the Q&A box as we go through the slides and the demo. I'm not going to be able to answer them right when you write them in, but at least you'll get that thought down. So when we open it up to the Q&A, we'll answer those first in a first come, first served basis, and the rest I will follow up with you offline to answer. We are recording the session and we'll share both the recording and the slide deck with everyone after the presentation has concluded via email. We'll also post those things on our socials, our YouTube, and our website for you to find later. For other folks, you can also direct them to if they weren't able to make it live today. A couple other things I did want to point out is we do have other webinars. So this is part of a monthly webinar series. The other week's we have trainings dedicated to a very specific tools, and we cover them in detail, what they're used for and like how you can actually use them. And most of them include some sort of demo. For the rest of this month, we have one on the HA admin tool, and then the our care coordination suite, so the Population Explorer and Send. Um, so if you're interested in those webinars, you can check out our events page on our website. As soon as you go to the home page, you can click at the very top upcoming webinars, or you could just go directly to this URL, crisphealth.org/events, and you can find all of the offerings that we have. We're continuously adding new ones every month, so it's a good place to come back and check in to find any other events that we are running in terms of training webinars. I did also want to point out we have our CRISP Summit coming up. So this is an all-day virtual event that we host to um, share best practices of CRISP and talk about some topics in healthcare. Previous topics we've done over the years, AI in healthcare, thinking about patient consent. This year, we're looking at more greater data integration opportunities. So talking about how we're integrating with things that are not just EHRs and EHRs as well, but in more advanced ways. We'll talk a little bit about our maternal health project, social determinants of health work, behavioral health work, some reporting dashboards we're building for AHEAD, and we'll touch on all of the new features that have been added to CRISP's tools over the past year. So if you're interested in that event, you can register. You're not obligated to attend. It's free. It's an all-day thing, but we will send out an agenda closer to the date, and I probably should have put it on the slide. It is May 19th, um, starting at 8:30. But once you get the agenda, if you want to sign up, you can always pick and choose which sessions you come to. Typically, they're around an hour to 30 minutes per topic that we're covering. And we have speakers across the state and organizations who actually use CRISP tools, kind of giving their perspective. So it's a great event. And if you are curious, I would encourage you to register, at least get the agenda, and then find out if you want to attend a few sessions. Apologize for not having the date on the screen. All right, that covers housekeeping. Now let's get into the main training for today. I will start about talking about what CRISP is. So CRISP stands for Chesapeake Regional Information System for Our Patients. We are Maryland's dedicated Health Information Exchange, or HIE, and health data utility. Our goal is to support providers, organizations, and communities by securely sharing clinical data to improve care, reduce costs, and improve health outcomes. We work as a affiliate as part of a broader health information exchange system called CRISP Shared Services, where we partner with that parent organization, CRISP Shared Services, leverage their technology and tools, and also are able to share best practices with the other states' HIEs that are participating with CRISP Shared Services. I believe this list is not fully updated now. I think Florida has also been added, and they're always continuing to expand to other regions, which helps us to expand offerings, increase efficiency, and understand what the other states are doing in terms of infrastructure. So why is CRISP important and why is HIE important in general? So this diagram is showing you how a patient, and we're all patients, really experience healthcare in the real world. You might receive your primary care at one place, and then you go see a specialist. Maybe you have to go to the hospital for an acute problem that you're dealing with. And all of these are dispersed and spread out and may or may not be part of the same system and may be using different technologies to support their patients. And so the value of CRISP is we help collect this data and connect all of these individual places to have a single patient record on file where we can integrate all of these data. Also, integrating all this data helps us to ensure that the the critical data follows the patient and it's not stuck with a provider across all of these settings, allowing for faster and safer and more informed care. We also use this data to support other health systems and public health efforts, support health equality, reduce redundant testing, and promote care coordination across different providers. Um, to give you a sense of all of the data that we do collect, here is a diagram that's just giving you an example of things that we collect from various systems. Not exhaustive, but to give you at a high level, we collect many pieces of data from hospitals and health systems, as well as ambulatory practices, including admission, discharge, and transfer feeds, CCD data, radiology, discharge disposition information. We have integrations with LabCorp and Quest, where accounts can share their numbers with us, and we can receive their data to put that also in the patient record. We work with the state of Maryland to receive claims information, so all Medicaid, all Medicare, and hospital all payer information. We also work with the state and serve as the PDMP for Maryland. We receive public health data, vital statistic data from our state partners as well. And CRISP participants are also giving us data, so they're providing us with their patient panel. They might be sending in things like care notes, advanced directives, care alerts, social determinants of health screening. They might be sending referrals, patient consents. All of that is taken in and can sit in one single patient CRISP record. And here's just a example of the scale that we're doing across all of this data exchange um, in a weekly and monthly basis, where we have many users searching for patient, but we also send data across the state. All of this is done in a very secure way. Security and privacy is the utmost of importance to us because it is the core of everything we do. Without this privacy and security and patient trust and provider trust, we cannot function as a HIE. We meet the highest compliance standards, including HIPAA, SOC 2, HITRUST, and ENAC, and back that up with regular audits, cybersecurity training, testing, and continuous monitoring. I did want to mention that Maryland is what we call an opt-out state. So patients are always included in HIE activities unless they choose otherwise, with the prescription drug monitoring program being the one exception to that rule. We encourage providers to update their privacy notices and give patient clear information on how their data is being used. We do have a tool called the consent tool where patients have even more control over if they want to share things like sensitive data with their care team or specific providers. Simply put, protecting privacy and building trust is central to how we operate at CRISP. Okay, so now that you have the background of what CRISP is, what do we actually offer to folks? And we'd like to break our applications and tools and services and processes into about 6 different categories. So first, at the point of care, this is kind of the clinical record that I've been referencing, is what most folks use CRISP for, either through data integration, using an application on their EHR, or through the CRISP portal. They can look at all of the data that CRISP has on a patient to make better informed decisions about their care. We have care coordination tools. The event notification system is the biggest part of that, our SEND system that provides alerts when patients are admitted or discharged, helping teams stay connected across settings. We also have a reporting and analytics team that help provide dashboards to measure outcomes and interventions. Program administration team that help to disseminate best practices and handle some of the admin for state programs, whether they be care quality programs or financial programs that organizations participate in. We work closely with the Maryland Department of Health around health data utility and public health. And finally, all of this is kind of empowered through our technical integration teams that are able to integrate with different platforms to pull and push data as needed. Who can access CRISP data? So here are some of the reasons why you might be using CRISP data for treatment of a patient, a public purpose, so legislation or a approved use case, quality improvement and care coordination for HIPAA, non-HIPAA covered entities, and then research, depending on if that research is approved by the state. All of these are published on our website for you to find. Now I will talk about account setup and management. So I'm assuming most of you have access to CRISP, but if you are a net new organization, the thing you would do to start and reach out to is to reach out to CRISP, and we would connect you with an account manager. We would get you to sign the appropriate documentation after we figure out what your use case is and how you can work with CRISP. And finally, we would collect a or set up data feeds and collect a patient panel. A patient panel is a list of your patients that you see or your patient roster. Um, and these things are used to support care coordination tools, patient search, and notifications that we might send you about your patients. It allows for kind of seamless transition to CRISP, and it is central to how we operate. When knowing who your patients are, we can make our tools available to you more quickly. Most folks will set up a data integration here to do this, but if you don't have an advanced EMR to do that or don't want to, there is a manual process of which you can do it through this tool called the panel processor. Most users won't have access to it other than maybe one or two at an organization. So I just wanted to point it out and show you kind of what it looks like. The HIE admin tool is another tool where uh, when you set up an account with CRISP, we will typically have one or a few users at your organization serve as a HIA administrator for your account, and they will be able to access this HIA admin tool and add new users to access CRISP tools, as well as deactivate services if they leave. All this helps you stay compliant and make sure your users are fully connected in an appropriate manner. So again, most users here won't have access to this tool, but I did want to share it in case you were curious of how you actually get access. It's through an administrator at your organization who has access to this tool. Once you do receive access, there's typically two pathways to receive CRISP data and look at CRISP applications. So we do have a embedded app for EHRs that your organization can set up with us depending on your EHR that you use. This is the in context tool or our clinical record system. But if you can't integrate or you don't have the EHR system that we can integrate with, it's no worries. You can use the uh, CRISP portal, which is our web-based platform, where it allows you to search for patients and pull up all applications, just even ones outside of the clinical record. So it's good, even if you do have access to the EHR embedded app, to also maybe have access to the CRISP portal so that you can um, perform those patient searches and use other CRISP applications outside of just the clinical record. Okay. Continuing on, once you get access to the CRISP portal, we do have password and two-factor authentication requirements. This slide is just to give you some background about what those are. But when you set up your password, it will tell you, and then we have options for two-factor authentication. Our preferred is to use the Authy application, but if you have other applications that you use for other tools and you don't want to download another one, you can always scan that QR code on the side of the screen. or you can use a token key, like a YubiKey, to do this. And we don't just stop there once we set you up. We have dedicated account managers and our user engagement team who are here to help you make the most of Crisp. So you can always email our support line, call our desk, email mdcommunications@crisphealth.org or your dedicated account manager. Um, to receive help, ask questions, figure out how the best way to use, or tell us your use case so that we can figure out what tools we already have or what custom tools that can be built to support your needs. We also have that website that I mentioned. It's a public-facing website where we store training materials such as user guides and videos like this to help you understand everything that Crisp offers. All right, so that covers the background of what Crisp is and some high-level account management stuff. And now I want to jump into the demo. So give me a second here while I pull up the demo site, and then you can have a sense of how to use some of the Crisp tools that I mentioned in passing, but you can see them how you can use them live. Right. Let me log in. Perfect. And let me pull it up here on the screen. Okay. So here is the Crisp portal. So this is the web-based portal that I mentioned. The clinical record piece that I'm going to show here in a second is basically how it will appear in your EHR if you have that in context app integration. So at least seeing the different tabs available there can give you a sense of what you could actually look like, what you could look at through the EHR when you search for a patient. So everything kind of starts here with patient search. But before I even do that, I did want to point out the dashboard is where you can find applications. Note that some applications require patient search first because they pull back one single patient record. For example, the clinical record that I'm going to show you. Um, but anything that is aggregate data can be clicked on from here without even doing a patient search. Other helpful things to know about the portal is if you're not sure who your HIA administrator is for your account, you can click up here and then it will show you who those individuals are. Um, there seems to be a lot at this account, but um, for you, you'll probably see like one or two or three other people there listed. Any product updates that we have, we'll publish here, and you can always use this button to send feedback to our support line. All right, so let's start off with a patient search. So let me search for our test patient, and this is all demo data, so no PHI is being shared here. So once I do a patient search, the requirements of a patient search are first name, last name, date of birth. You can further refine it through gender or social security number if you know those things. And then you can click search. It will query our database and then it will provide you back with match scores for the patient demographics that you put in. So this is how confident we are that this is the patient that you're looking for based off of your patient panel and also the demographics that you put in specifically. And so once you found your patient, you can click to open up another Crisp application. So as you can see, once I clicked here, it brought up the select app thing, and then also our dashboard populated with more tools that we could use. So four things that I want to cover today: the clinical information service. So this is the clinical record, screening, create referral, and the consent tool. So let's start with the clinical information system or in context app. So once you click that, it will ask you to reselect a patient if you had multiple matches, I guess, on those demographics. And then you can use these bars here to slide um, the rest of the reports and applications and open up just the tabs from the in-context view. Um, so I will actually start here with medication management, but you can see our tabs are patient information, my patient summary, which I'll cover later, medication management, clinical data, care coordination, social needs data, data from claims, and then other applications. Um, So in medication management, this is where you'll find three tabs. You'll find the prescription drug monitoring program. And I did want to touch on prescription drug monitoring program in a little bit more detail. This is where you actually find the data, but we do have other tools built to support that, such as our delegated dashboard or our prescriber insights. But here is where you can actually see the information of any PDMP prescriptions that have been given to the patient that you're looking for. But the prescription drug monitoring database allows healthcare professionals direct access to tracked filled prescriptions for controlled substances. It helps prescribers, pharmacists, and public health professionals identify potential misuse while ensuring patients maintain appropriate access to needed medications. So all of that can be found here, as well as dispensed medications that are not part of controlled substances, and then any reported medications from CCDs. I apologize for this test patient not having data here, but you can imagine these fields being filled if they did. Let's go to clinical data now. This is where you'll find a bulk of the information regarding the patient. So it starts off with health records, which is really three sub-tabs: labs, radiology, and clinical notes. I did want to touch a little bit on radiology because all of this is empowered by the image exchange, which allows healthcare providers to view and share patient diagnosis images with a single secure location, improving collaboration and efficiency in delivery of care. So all of the images here are from that image exchange system. Um, and then you can click here to open up images and see them through the viewer. It does take a little bit to load sometimes. So if you are going to look at an image, you might want to continue clicking around and pulling the information that you want and then coming back to that. But I did want to point that out specifically. Um, Structured documents of things from CCDs will be here. And then in some of the other tabs, we are parsing things from CCDs. So this will give you kind of the document view. And most of them open up and you can actually click through the different tabs. Um, to get to where you want to go. But sometimes if you're in a rush, it might not be as helpful to look through this whole thing, or especially this whole stack of things if the patient has had multiple um, clinical documents sent in for them. So what our team is doing is starting to parse things like from these, such as problems, immunizations, allergies, vitals, and procedures. So these are great ways to kind of get all the information here in separate tabs. We also have encounters from hospital and outpatient, and you can kind of view them as such. All of the tables in here are filterable, and the search works great. You can type in um, anything and it will search all of the fields and in any of the text here. So if I even search just for diabetes, let's say, it found this diabetes string and the full table that we were looking at. So the search works really well and it's embedded in all of the tables that you're seeing. I'm not going to go through all of these tabs. If you want a kind of fuller picture of that, you can attend our in context training. I think we have one next month. Um, but this is kind of just give you a sense of what is here in the CRISP clinical record. I did want to come back actually and talk about a new feature that we just added to labs called Timeline View. Um, I wonder if this patient doesn't have the best data for this, but you can kind of imagine from this picture. Essentially, what we're doing is all of the labs that we have received, we're breaking it out into a timeline view. Um, with the most recent here on the left side and then other labs across. So, for example, if you have a patient who has had the same set of labs done multiple times, you can kind of see the progression or changes across time for those set of labs. And this is a great feature, especially if you're wanting to look at a change over time for a patient if you're, giving them a certain medication and you want to see the effect of that. So another cool feature that we just added to this tool. All right. You might notice as I was going through all of these different tabs that there's this TAC icon available. So this connects to what I said I'd come back to, the My Patient Summary, this tab here. So what happens when I click that tack, it actually pins it to this custom dashboard. So as you're going through all of the various things, you can kind of pin the pieces of information that you might want to see on every single patient that you're searching in CRISP. And the cool thing about the My Patient Summary, I'm sorry, this is not loading quickly. Let's say I want problems. There's nothing in procedures or vitals, immunizations. There we go. Um, so let me remove this one. So basically what happens when you build this custom dashboard is it saves to your My Patient Summary. And so every time you come back to this patient or any single patient you search, you can go right to My Patient Summary and then you'll see just the pieces of information that you have pinned to your dashboard. You can always unpin them by clicking here. And again, this will automatically save and persist throughout time. So every time you come back or search, any last pieces that you had will save. And you can always come back to that exact way you had it. You can also move pieces of information around. Um, so you can always quickly find the information you want. So I'd encourage users to maybe use this once, pin the pieces of data that they want to see on every single patient, and then come into user settings and then move My Patient Summary. It probably will be at the bottom, but move it up to the very top of your order. And then every time you come into the clinical record in context system, My Patient Summary will be the first thing that appears. And then you can just scroll quickly through the data that you need and get back to interfacing with the patient or doing typical provider tasks. So it's a great tool to save time, and then customize the way that you're pulling data out from CRISP. Um, all right, so again, we have dedicated trainings more on the clinical record system, but I do want to move on to other CRISP tools that we offer. So you might have noticed in the clinical information system that there was a social determinants of health section. So we do offer a platform to send in social determinants of health screening. So if you clicked screening, you can find this direct entry screening tool that we have. Um, Different organizations might choose to set up their own screening tool with CRISP. If you come to this Accountable Health Communities related screening tool, this is where you'll find entries into all of the different areas that are known to affect social determinants of health. So you'll see things like housing in homelessness, food insecurity, transportation, substance use, stress, all these things that you can fill out. And you can choose to fill out one section or a few. And then if the patient consents, you can submit this, and then it will populate in that CRISP clinical records section in the social determinants of health part. We also are parsing data from Z codes. Um, that come in through the data that we receive and populate the tool that way. So if you want to run social determinants of health screening, it'd be super helpful for the other people who see your patient and use CRISP. But it also might be good for you to have a better accounting of social needs that might be impacting your patient. And we offer a way to kind of store that data without you having to do it through forms and such. The other thing we offer is a referral tool. So CRISP partners with community-based organizations as well as Maryland 211 to send referrals to organizations. Not every single program in Maryland 211 is referable through the CRISP tools, but lots of community-based organizations work with CRISP. Um, so you can search for things like diabetes prevention programs, or you can even search by a radius just to see what's near you. Um, and through this, you can actually either get at least the contact information, or if available, send a referral through the system. So most of these are actually, looks like if it says HIA directory, that's typically ones that are available to refer through our system. And what you could do is you could actually click and then send a referral for the patient. Typically, the referral programs might have custom questions that they ask you, maybe upload some files, and then once you have all of that pieces of information filled out, you can actually send the referral, and they actually have a platform through CRISP to receive the referral, and then give you some feedback on if that patient was accepted, denied, or enrolled in their program. I did want to touch on patient consent. So I mentioned that CRISP is a opt-out state, so everyone is defaulted to being included in data sharing, except for a couple things. 42 CFR protected information, and then Maryland does have a maternal health law to protect sensitive maternal health data. So we have a couple forms to actually allow CRISP to share this data with that patient's care team if that patient so chooses. Um, and it is helpful to know, these categories that are excluded from data sharing, because you might be seeing a patient who you don't see their full data, and it's because they haven't consented to sharing um, substance abuse or maternal health information uh, in this way. And so clicking through these forms with a patient, you can send that in with Chris, and then we can start sharing some of that data. So I did want to point out that tool. All right, some other tools to know. Um, let's go to reports. So in reports, if you do have access to this, um, You can always request access to it. But what I would recommend is probably going to our public website first because we have many reports that are built off of many different pieces of data. Most of it is claims-based information, but we are starting to work more with clinical data and reporting on that. We also do have public health data. I'm just going to click some of the public health reports just to show you what those look like, and so you can get a sense of the power of the reporting team that we have. Um, so this is our public health dashboard within reports, and this is pulling all of the claims data in Maryland over a long period of time. I forget how many years, but allows you to kind of slice and dice the data through different demographic filters and race filters, payer filters. I think there's even some dashboards here where you can actually click through the map of Maryland to see certain things. Um, so it is a very powerful service. We also have tools or also have reports within the reporting system that are based off of your patient panel. So could give you insights about the utilization metrics of your patients specifically that you've seen. Um, we also have tools in the reporting suite to evaluate interventions that you are running, where you can run a pre and post uh, intervention type report. So there's a lot here in reports. I'm sorry, this is not loading. There's lots of data in the tool. I just kind of wanted to show you visually what it looked like, but I think this would be a map of Maryland that is interactive. Um, so, um, where was I going? So there's lots of different tooling that we have in CRISP to view things from a public health utilization. Here we go. So you can see the visits um, per some population adjusted metric within the counties in Maryland. And then you can isolate different things to further refine the graph. And so our reports teams build reports like this, mostly using claims-based data. We do have some clinical ones. And if you are curious, we have some webinars and demos on our website to learn more about all things reports. Okay. Anything else that I want to cover here? Prescriber reports. This is other things having to do with PDMP. So if you are a prescriber of uh, controlled substances, you might have access to this prescribers reports where you can actually see your prescribing patterns. Um, and then um, we do have a delegator dashboard in here as well for PDMP. Um, there's one other set of tools that I did want to cover. It has to do with care coordination. Unfortunately, I don't have access to it through this portal. I'm going to actually stop sharing and then I'm going to actually go to our staging site to pull that up for you. All right. Have that up now. So you'll see this is looks exactly like what we were just looking at. The only difference is there's this thing on the side called Population Explorer. So if you do have access to it, this is our care coordination tool. Um, it's part of a larger system we call the CRISP Shared Service Event Notification Delivery Service, or it's called SEND for short. It's our internally operated alerting system that matches your patient panel against real-time health hospital encounter data. The twist with this is unlike traditional encounter-based alerting systems, our tool also can deliver customizable notifications on other pieces of data outside of encounters. So things like death indicators, things like lab results, um, things like utilization metrics, even things such as risk indicators like pre-diabetes, social needs, things like that. We have more information on our website about some of these custom alerts. Those things need to be set up, but I did want folks to be aware of that. What comes kind of fully packaged is our event notification alerts here. Um, that broader system for care coordination data sharing can be integrated to various EHRs if you have like an inbox in basket there. We have even worked with organizations' internal care coordination tools to send data into that system. Again, all those two ways of getting the data would need to be worked through with our data integration team. But if you're interested, you can reach out to us. Um, the other way that we share this send data is through a MFT folder. So something that we set up with your organization where you can actually draw down a file of data, maybe once a day, I think. Um, and then the other way to do it is through this Population Explorer tool. And this is a great way to actually kind of leverage some of the software that we built to kind of slice and dice and filter the data, and then also use other tools such as the clinical information system to kind of look up a patient more specifically. So the first thing you'll do to start looking at data through Population Explorer is select the panel of your organization. Most organizations will just have one, but you might have multiple, depending on if your organization has a subset of patients that they want to send to us, or many patients that they've cut over different reporting uh, panels. And so you would select a list of patients that you want called a panel, and then you can actually hit this slider to see all of the notifications on the left side of the screen. There are two views. There's the detail view, which is named because it will give details about a single encounter. Once you click on it, you can kind of scroll through and see the different information here. Like this is mostly the encounter details that you'll see. There's also a table view where if you are actually using this system for care coordination, you can click through the follow-up of that patient, and it actually integrates with the rest of your team. So if three people, for example, are looking at this specific panel, any changes that they make will kind of reflect back to the other members of the team through this tool. Um, there are data exports you can have for this data, and there's filtering that you can do. Basically, every single piece of fields that you can see here are filterable, and then you can save your filters. So you can always come back if you always want to look at one piece of information, for example, or one subset of encounters or pieces of data. Um, this button here would enable you to kind of change the notification types that you're seeing. So encounters is what we kind of talked about. Notifications, these are the custom notifications that I mentioned, and then preventative services. So I will mention that we have started to send alerts based off of preventative services that folks have had. Colorectal screening, for example, is one of those. So every time one of your patient has a colorectal screening, you will actually receive an alert here in the system. So you can actually um, see a little bit more about what was done there and the results of that screening. The other cool thing with the tool is um, if you right click if I could get this to work. If you right click, you can do the same thing that I did at the very beginning when I searched for a patient. So let's say you get a notification on someone and you want to look into their patient record more closely, you can right click and then you can jump right to the clinical information service from here and some of the other tools that you have access to. Um, Again, we do have more information about this tool in detail, but I wanted to give you a sense of what it looked like and why you might use it. So now I'm actually going to jump back to my slide deck here. Um, and I think that's everything I wanted to cover, but I did want to mention before I open it up to questions, um, that we have our website, but then we're also available to do more specific organizational training. So you can reach out to mdcommunications@crisphealth.org if you're interested in running a CRISP training for your organization. We just ask that maybe you provide us a little bit more details about what you're looking to understand or your use cases, and our team is happy to set up a specific one-on-one training with your organization, either virtually or in person. So don't feel shy about reaching out to us. Um, I'm going to open it up to questions now from the Q&A tool. So if you have more, please put them in now. I'd ask also as a favor if you could take the survey on the left side of the screen, scanning that QR code. I We take feedback from folks who have taken this training and adjust this training to better serve our users. So if you could take that, if not, no worries, but appreciate anyone who could. All right, so someone asked, you might be planning to get to this, but in the case it isn't addressed, is it possible to conduct a patient search of several patients at once? For example, to input a whole spreadsheet of patients' MRNs that you're hoping to match with certain CRISP data. Interesting use case. That is not available through the traditional CRISP portal. I'm assuming you're trying to use that for some sort of research purposes, or maybe you just want a data download or dump. What probably would be better is if you reach out to CRISP on your use case. Maybe there's a data integration that we could do to send you more data. But typically when we send data, it's for one of the purposes that I mentioned, either care coordination, treatment, um, um, or research. So I think it kind of depends on your use case here and what you're actually trying to hope to do with that data. But happy to maybe give you a better answer if you reach out to me offline. I apologize. You wrote in anonymously, so I cannot follow up with you unless you message me directly. When you pin data to show on my patient summary, does it apply to one patient or all patients? All patients. That's a great question. So wherever you last left your My Patient Summary in terms of the data that you've pinned will apply to every single patient that you look up in CRISP. So again, it's kind of a great way to create a custom dashboard and then always come back to it. So when you're using that feature, I would keep in mind what are the pieces of data that I always look for. And then I would pin that data there and you can kind of just scroll through it. You can reorganize it and change it over time. But whatever you last left it as is what you will see for any patient that you look at. Can social determinants of health referrals be generated and tracked from in context? So that apps tab that I showed you, and maybe I have a screenshot of it here in the appendix. This apps piece here, if you click that, there should be a integration that allows you to quickly send a referral through the in-context system for that patient. All right, someone asked if I work in a protected information area, what special precautions slash permissions should I take, if any, related to CRISP usage? I mean, it's a great question. I guess it would depend on um, your organization's um, okay, sorry, I'm rereading your question. If I work in protected information area, what special precautions, permissions should I be taking, if any, related to CRISP usage? I would just be aware that this data isn't inherently shared unless their patient has consented with CRISP. So, if you're looking up a CRISP record, you might not see the data that you think that you should because that patient actually hasn't consented to sharing you that data or sharing that data broadly with other CRISP participants. But I don't know if there's anything else that you should be thinking about or aware of. But that's what I would keep in mind is that data in particular is mostly um, protected unless the patient consents. So maybe even talking with your patients more about patient consent, especially if you work with other providers who do use the CRISP system, um, could be something to think about. Uh, a quick aside, we did have in our last annual summit, we had a session talking about this kind of problem or what to think about in terms of sensitive data conversations with patients. So I might check that out. I can send you the link to that offline, but it's a great question that made me think a lot. So I appreciate it. I apologize if I wasn't thinking the same way that you were, but just from what you wrote, that's kind of where my head went. Um, do I use radiology tab to look for prior images from another imaging facility? Yes. The only caveat with that is not all radiology centers right now integrate with CRISP through our image exchange. If you're looking for a very specific facility and you don't see that facility, it is always a great idea to reach out to the CRISP team, and maybe you can provide us with an in-way with that facility so that we can get them set up to share data. You can also reach out to us, and I can provide you a list of the radiology centers that are currently providing images to CRISP, so that you know that, and then maybe can tell us other places to go look. Some hospitals provide more clinical data after the hospital discharge than others. What is the barrier that is preventing certain hospitals from having more hospital progression notes and discharge notes available? That's a great question. It's something that we work on with our hospitals in terms of data quality. So we provide them with some data quality insights, and we try to have conversations with those hospitals to work on those things. Um, and then some of it also depends on maybe the EHR that they're using. But it is a great point and something that we do work with our hospitals to ensure data quality. Um, um, we always refresh the data in real time as it comes in. So if you've already made note of those facilities that might be slow to send that data, you might just want to, make a note to come back to that patient encounter later as things progress and more information becomes available. But quality at the first ADT is something that we do look at and work with our hospitals on. But it's a great point. I just got access to CRISP but don't have access to view clinical data. I'm able to pull up a patient but unable to see anything other than their pharmacy information. So it sounds like you might have access to CRISP just for PDMP purposes. Um, and your organization may or may not have, the clinical missions broadly. We can always work with your organization to set that up, or it could just be a error with the way your administrator has set up your account. So if you could reach out to me, and I can provide my email really quickly. Um, you I can look into your account more in more detail and see what's going on to give you a better answer. But top of my head, that is what I am thinking. All right. I answered all the questions in the chat. We are at one, but I can stay on for another minute or so to answer any other questions that come in. But appreciate those of you who have to drop, who attended this training. So I'll stay on for one more minute to answer any questions. Alrighty. See no other questions. I appreciate everybody who joined today. Hopefully you got some things out of this. Could you send me that presentation about the protected data? Oh, yes, I will. Thank you. And but I appreciate everyone joining today. Um, and hopefully you have a great rest of your day. Please reach out if you have any more questions about CRISP. Thank you.